Hi, I'm Dr. Vinatha. I'm a senior consultant in Cloud9 Hospital, High-Tech City branch in Hyderabad. Some cesareans are planned cesarean section, maybe because they had so many cesareans before or they were told to have a cesarean for some reason. These are planned or also called elective cesarean section. So the other types or the most common types of cesareans that we do are an emergency cesareans. Means we don't plan that cesarean. We go thinking that women will have a normal delivery, something or other changes, and then the cesarean will become necessary for them. So they are called emergency cesarean sections. So we have so many categories of cesarean sections also. Depending on how soon we have to do a cesarean, we have categories. Like category 1 is the cesarean is must to save the life of mother or the baby, and it is so emergency that you have to have the baby out within 20 minutes. These are called category 1 cesareans. That is an extreme emergency, and we do drills to make sure that it can happen and the whole team is ready to do so. This is only when you think if the previous cesarean section is trying for a normal delivery and we think the scar has ruptured, then the baby can die very quickly. So this is only times that we think minutes matter. We do this category of cesareans. Sometimes a cord around the baby can come down. The position of the baby is not right, it's not head down, it's across. Then the chances of this cord coming down with water break is high. So these are the times that we have to do in a very, very emergency situation. We call it as category 1. What is category 2? Then cesarean is necessary, but it is not an emergency that we have to do in 10-20 minutes, but it has to be done within that hour. When we think baby is a little distressed, but not so much that we have the baby's heartbeat is down and not picking up, but baby's heartbeat is going down each time, it's not correcting. We think there is a problem with the baby. So we need to be a little hastening things, but not to an extent that, everything is dropped down without consent. We are going in, wheeling straight to theatre, we call it. So usually it is done within 1 to 2 hours of decision. These are category 2. What are category 3 cesareans? Which is, it has to be done, but to suit the time of women and the team, we can plan. We are planned to do a cesarean, but you come in an emergency with pains. So it has to be done, but it is not an emergency. Baby is fine, mother is fine, but we have to do in that day. So around 6 hours or 8 hours, we can plan based on various other things. When you have had food to eat, you can wait till you are safe to have anesthesia and then get this done. We call it as category 3. Category 4 is when you plan a cesarean, you give a date, you come on admission, then we call it as category 4. So this is categories of cesarean. And now we have seen planned and unplanned, emergency and elective cesarean. These are types of cesarean sections.